Thanks for coming in to review Mrs. Duncan. We've been concerned about her for the past few days. Her breathing has gotten much worse and she's getting very agitated at night, and we're finding it difficult to control her pain.
Yes, yeah, look, I've had a look at the notes and her condition is clearly deteriorating. I really do need to go have a look at her. Yeah. I've made some adjustments to Mrs. Duncan's medications, which I think will help. But look, she is really sick with realistically what is a terminal condition. Look, she understands this, and I've had a conversation with her, and I think it's time we set up a resuscitation plan, 7-step pathway.
Okay, I've heard about this resuscitation pathway, but I've never actually seen one. What does it do exactly?
A resuscitation plan is a pathway which guides a doctor through a step-by-step process of making decisions about things like resuscitation, treatment and end-of-life care for a patient who is at risk of deteriorating and dying. It includes instructions about whether the patient's for CPR, whether they're for life-sustaining treatment or not, whether they want to go to hospital or not, but most importantly, whether they should be for palliative care type medications if they deteriorate and suffer distress as they're dying.
So what's the difference between an advanced care directive and a resuscitation plan?
The advanced care directive is different in that it's a legal document which in essence represents the patient, in that they are able to write down who they want to represent them when they can't make decisions, and that's a substitute decision maker, or they can write down specific wishes and instructions for a time that they can't make decisions. Now, that may include things like refusals of care, which must be complied with if they're relevant to the situation. Now, this is different from a resuscitation plan, which is written by the doctor concerned and responsible for the patient in regards to writing specific instructions about CPR and end-of-life care, which is really for other health professionals so that they can act in an emergency. So it replaces the CPR orders and not for CPR orders that doctors have written in the past, but also includes other instructions. So it's kind of like an extension of the medical notes.
So with the doctor making all these decisions, where do the wishes of the residents come into it?
Oh, look, an important part of the resuscitation pathway involves talking to the patient or consulting their advanced care directive if they no longer have the capacity to make decisions. As you know, quite often you have advanced care directives with very ambiguous instructions which are not very helpful in an emergency. The resuscitation pathway allows us to translate these into very clear clinical instructions about care.
Okay, I see where you're going with it. I've got Mrs. Duncan's ACD here, and I notice that all she really says about end-of-life care is that she doesn't want to suffer and that she wants to maintain her comfort and dignity.
Look, yeah, that's why we need to speak to her while she still has the capacity to decide. We really need to talk to her about whether she wants CPR, if she was to have a cardiac arrest, and also whether, for example, she wants to go to hospital if her heart failure was to deteriorate.
So it's really a way to incorporate her wishes into clearly documented instructions about end of life and resuscitation so that everyone that's caring for her can implement it. But I've noticed that Mrs. Duncan's daughter Olivia and her good friend Peter are her substitute decision makers in her ACD. Do they need to be involved in all of this?
Look, at this stage, Mrs. Duncan has the capacity to make her own decisions, so she's the main person we need to consult at the moment. Now, if she gives us permission, it's great if we could also involve Olivia and Peter in the decisions, because it's much better to have them involved and on the same page.
Dr. Moy came in to see Mrs. Duncan today. As you know, her heart failure has worsened in the last few days, so he's adjusted her diuretic and ACE inhibitor to improve her breathing, and he's also completed a resuscitation plan 7-step pathway for her and included her substitute decision makers in the discussions. It documents that she's not for CPR and she'd like to stay here and be cared for rather than transferred to the hospital should her condition deteriorate further.
Yeah, that's good to know. It makes it easy when there's a clear plan put in place for the residents' care.
The resus pathway is filed at the front of the notes with her advanced care directive, and I've also added an alert to our handover sheet so the rest of the staff are aware of what's going on. Dr. Moy has also written up orders for PRN, morphine, clonazepam and Maxolon.
Okay, great. I'll have a good look at the plan and then I'll make sure to hand it over at the next shift.